Well, here we are again. I'm Donna Chaco with Serenity and Health, and it's just a pleasure for me to be here this morning with Pastor Mark Greiner. Hi, Mark.
Hi, Donna. Thanks for having me today.
Oh, it's just a pleasure. Mark and I got connected just by a mutual acquaintance at Christ House in Washington, D.C. And I guess that person said, you two have to get together. You have so much in common.
Yes.
They were right.
Yeah.
So Mark and I got to be friends over the last couple of years, and he has a remarkable story. Let me just tell you briefly that he is Presbyterian, right?
Correct.
Yeah, Presbyterian minister with his own church for more than 20 years and was well loved in that role. And then made a major life shift, which he's going to tell us about, to become a trained acupuncture specialist. So he graduated from the very grueling 3-year program at so it's the acupuncture from the Maryland University of Integrative Health. And then set off for Nepal for an internship until the COVID-19 crisis changed that. And now he is in practice doing his ministry, and it's just a perfect match for what fascinates me, which is how health of body, mind, and spirit are so interrelated. And I know that's a big part of his medical approach, his spiritual approach. Anyway, he's going to tell us about it. So how in the world did you go from being a pastor to an acupuncture doctor?
So to me, the two are very much in continuity with one another. The language of acupuncture classically is that it treats the body, the mind, and the spirit. And whenever we touch a person, whether it's physically touch or emotionally touch a person, when we touch a person, we're touching a person at all those levels simultaneously. So, for all these years of being a pastor, where I was most focusing was of the care of spirit, the care of mind and emotion, the care of heart. And I really didn't have the skills to bring it full circle and care for body quite explicitly at the same time. So what the training in acupuncture allows me to do is really consciously address body, mind, and spirit, and gives a whole wide variety of tools for working across these 3 levels.
So since you came back from Nepal, you've started your practice, right?
That's right.
Well, so tell us about it. What do you do?
I love what I do. I'm practicing. The name of my own practice is Pastoral Acupuncture and Wellness, and I'm part of a larger group practice that's called Crossings Healing and Wellness in Silver Spring, Maryland. It's one of the oldest established multimodality practices in the United States, and it has a very strong focus on trauma-informed healing and training people in trauma-informed care. So that's really deeply meaningful to me to be able to be there, partially out of my own family history, and that my father was career military, so being able to treat people that have a traumatic history and PTSD feels like a way of honoring my own family and carrying that legacy forth. So when I care for people, I do an initial intake and listen really quite carefully to what their concerns are, and then navigate with them a care plan to address whatever their needs are, really focusing and shifting depending whether their primary concern is more spiritual, more emotional, or more physical.
See, this may be foreign to our listeners. It was a little bit to me, Mark. I don't know too much about acupuncture. And I think for many people, they think, what's he talking about? I thought he would just be putting needles into people. So you have to spell it out a little bit how you are integrating this, emotional, psychiatric, spiritual care into the actual use of the needles. Tell us how that works.
So there's in the school that I attended, one of the phrases that they use that I think is really beautiful is word as needle. the needle being the notion of the point of intervention. Well, the words that we use are so powerful. Thich Nhat Hanh has this beautiful saying, I'll find it for you and you can post it after the interview. But basically the saying something is along the lines of mindful that words can heal or wound. I will seek to mindfully use language in a way to support joy, freedom, and well-being. So part of attending to people is really attending to their speech and listening quite deeply. I believe there's a deep yearning in all of us to be heard and understood. So a big piece of the spiritual care is being able to listen to people, reflect back to people, and sometimes being able to open up their story, help them to see their own story open up to possibilities that they had not foreseen previously. I'd like to say something more there, but I'll pause to see if you have any question at this moment.
No, I think so. Carry on. It's fascinating, and let us know, like, how much of the time. It sounds like you spend a fair amount of time talking with your you call them clients, patients.
The language goes back and forth. I really like the term patient for a couple of reasons. Frequently in life, and particularly now in the pandemic, frequently the virtue of patience. So I'm playing with it's a homonym here, but the virtue of patience is called upon. But the other piece is that the word patient, the background of it has to do with passion, and passion, the root of that having to do with suffering. So part of what I'm wanting to do is really pay attention to the quality of suffering that people experience. Now, at the same time, I'm not only paying attention to only their suffering, I'm really paying attention to their joy. And so one of my favorite questions in an intake is to ask in someone's life, what is flourishing? I don't know that I've ever had the experience in Western medical modalities, which I value greatly. Western medicine is brilliant. And I don't know that I've ever had the experience with a Western medical provider being asked the question, what is flourishing in your life? That opens up conversations in beautiful ways so that people can be known and can see something of their own brilliance and the possibility of how they've been created in the divine image and what's being called forth in their life. Yeah. So this notion of really deep attention to a person's joys and sorrows actually feels to me deeply liturgical. So I am also a pastor. There's a beautiful book on pastoral care that's called something like Mighty Stories, Dangerous Rituals, that talks about the life cycle events that we go through in a church context, like the sacrament of the sick, or baptism, or weddings, and how those liturgies, if they're done really, really well, can be pivotal points in a person's life and in their family's life in opening new directions to live into, I'm going to say this in a Christian context, into the life of Christ, or in a broader theological context, is the divine life that God would have for any of us. If we really pay attention to where, to these nodal points in our lives, they can open up in new ways possibility for us. So while I do that in liturgy in a church setting, that's also possible to do in a one-on-one interaction. And I find it deeply respectful of people.
Flourishing, that's a great word. I have to say, I don't think that in all my decades of doctoring that I probably asked a patient if they were flourishing. And in fact, we should all ask ourselves to look for those parts of our lives that are flourishing so we can celebrate them and be grateful for them. But Mark, I just think people are going to be so intrigued to hear you talk, because this is not what they think of with acupuncture. I mean, it really does sound like you spend, 80% of your time talking, 50% of your time talking?
Part of it
listening and listening.
and listening. I would say primarily listening, and then some talking. Particularly in the initial part of treatment, it's a lot of listening. But typically in an hour-long session, at least 15 minutes is really spent with that listening. However, what I would want to say is that the listening is not only to people's speech. It's listening, or not only to their words, it's the quality of speech, it's the emotionality in their voice, it's their intonation, it's the flushing of their face. What might bring forth emotion, and what emotion is it? And it's also paying attention, really listening to people's bodies. So a big piece of what I do is actually palpate. I'll touch acupuncture points. Points are arrayed along channels in the body, so I'll pay attention, actually physically paying attention to the channels. So the listening is to words, but it's also very much to bodies. And one of the notions is that sometimes sometimes we don't know our own bodies that well. So if I'm paying attention to both levels, sometimes the body will tell me something that a person is not aware of in their own speech.
Mm-hmm.
Yeah.
Yeah, fascinating.
Mm-hmm.
Mark, I noticed that you talked a lot on your website, which we're going to put all this information, everybody, in the references and his quote and everything on the show notes, which you will have access to afterwards. But anyway, I noticed you had a strong emphasis on rhythm and balance.
Yes.
And where does that fit into all of this in your philosophy and the mind-body thing?
Right. Well, I'm so glad that you asked that question. So let's think for a moment about the rhythm of the world in which we live. So there's every day, day dawns, and we move to noon, the height of day, and then we move to midnight, the depth of night, and there's that circular rhythm. So there's cycles of activation and rest that happen every single day. There are many different kinds of cycles, but that's one of the large cycles within which we live. There's also the cycles of the seasonality across the seasons of the year, and our bodies respond differently at different times of the year. So we are part of this larger, more than human world. Bill Plotkin uses this phrase, more than human world. I think it's a beautiful phrase. So we're microcosms of this larger macrocosm. Okay? So we can move into states where we are really activated and it's difficult to rest. So we're in a kind of daytime state, even at night when we should be sleeping. Or on the other hand, we might move into a state of where we're very slow and it's hard to get going. So to the extent that this daily kind of balance is not working well in our lives, what Eastern medicine, which I think is a better, broader phrase than acupuncture alone, what Eastern medicine can help do is reestablish that balance, because that's part of the divine endowment for us to live with, is this balance. We were meant to live in balance, and when we come out of balance, sometimes we need a little help to have that restored.
Yeah, that's kind of cool. I had this thought, my logo has 3 rings with the cross in the middle, and I thought in my head of the 3 rings as body, mind, and spirit, and they're not exactly overlap. They're close to overlap, but in my head I would think like, yeah, so if they were really out of alignment and imbalance, like say maybe a jock that ignored every other part of their life,
Yeah.
or maybe a person who had a spiritual life that was a little off balance and excluded people or whatever, I don't know, but the way they could be off balance. And that it kind of reminds me of what you said. We do have to be balanced to some degree, and everybody does it in a slightly different way. We don't all balance out the same.
Mm-hmm.
So do you find imbalance with your palpation and your how do you see that in your in Eastern medicine? How do you observe that, or do you hear it?
So I'm thinking of one example specifically. So there, may I use for a moment a bit of Asian medical jargon?
Sure.
So I was talking about coming up to midday, noon, and the height of sun, and then midnight, the depth of darkness. So if you can envision that yin yang symbol, that circular symbol, where half of it is in light and half of it is in darkness, and the two interpenetrate. So the light side is called the yang side, and the dark side is called the yin side. Both are necessary. So that form of perception is really talking about the natural cycles that exist in the world. Well, those things also exist within us, for instance, in thinking about hormonal balance. So there are hormones, especially if associated with the daytime and with our activation, for instance, adrenaline. On the other hand, the evening, there are things like melatonin. So if a person is able to get to sleep, but not stay asleep, that's probably a sign that they're deficient in one way or another, deficient in those hormones related to the evening. So paying attention to what time of day people are experiencing difficulties. One way of reading that, for instance, is a hormonal imbalance.
Oh, that's fascinating.
Mm-hmm.
I can't imagine this such a major change. I mean, I changed specialties from radiation oncology to family practice, and I thought that was huge. But this is like a planetary change, which you have done. What was was there like a biggest surprise, something that you found when you made the change that you just had not anticipated at all, in a good or bad way, in a good or challenging way?
I think probably the biggest change, or the biggest surprise that I just hadn't really accounted for in my own being, was the difference between pastoring a church, which I'm accustomed to and still do some of that work, and being on a salary, and running my own business, and there being no salary, but having the income be generated through in hourly time slots, and all the necessary pieces of running a business. Now, this is not an especially medical or spiritual piece of our conversation right now, but it's simply a reality that all of the components of business planning and business administration, that I'm in the midst of that learning curve as we speak.
But you know, Mark, it's a really valid point. I was just thinking about this the other day, about no matter what profession, how noble, how wonderful, how fulfilling, every calling has its paperwork or its electronic medical record or its billing or it's something, you know what I mean? It's paperwork. It's just, we all have to be, that's the way life is. I don't think anybody, the Pope or the president, especially the president, anybody is immune from all that. There's always that. Yeah. So interesting. Do you miss something about your previous life, particularly?
I think what I miss most from my previous life is regular interaction with children. I really enjoyed youth ministry. I really enjoyed doing children's sermons. And now the patients that I see are almost entirely adults.
Yeah.
I'm still sorting through how can I be more regularly in contact with younger people.
Oh, interesting. Yeah. I would like to switch gears and have you, with your perspective, because it's very, very broad now. Let's talk about what, with all of your years of experience in both of these fields, what things you might suggest to our listeners if they're out there. We all have issues, right? We all have stuff in our lives that could be better. Maybe we don't feel good. Maybe we eat too much. Maybe we can't sleep. Maybe we are constantly worried, especially now in our brains. So no matter what's going on with each of us, do you have any like suggestions of take-home steps that listeners might take that would help them find better health of body, mind, and spirit? Other than seeing you in your office, we know that would help, but other things.
So I think probably two things. The first is this. My aim as a practitioner is to help people realize they really are their own primary healthcare providers. And my aim is to equip people to be the best primary health care provider for themselves that they can be. So what does that mean? It means a couple of things. It means trust the wisdom of your body. If you aren't feeling well, for instance, pay attention. I don't mean that in a condemning or judging way, just gently pay attention. What is your body seeking to say? And if you're not sure what it's saying, but you know it's saying something, then seek out those sources that can help you pay attention and listen to what it is saying. The second thing with that is that I know in my own life, I had a tendency, particularly as a younger person, to think, oh, well, if I've got an ache or a pain or a difficulty, I want to go see an appropriate professional to help me with it. And that's very important. We all need a little help. But I think I had a tendency of thinking, oh, well, so-and-so will be able to fix my problem. And a big piece of what I emphasize with people is having a healing partnership. That what I'm really trying to help people do is to increase the level of their mindfulness and their own practices around things like diet and sleep hygiene and exercise, those things that they can do to support their own health. So I want to be cautious here that nobody feels blamed that if they're sick, it's all their fault. That's not the point. What I am wanting to say, however, is that each of us can really support our own health through any number of different practices. And Donna, I think that's a huge piece of what you teach, actually.
Oh, I can't believe how you just said what you said so articulately, Mark. That is exactly it. Exactly it. You just summarized everything. That was just absolutely outstanding. And he wasn't prompted. I didn't prompt him or anything. In the clinic, what I would see, and I mean, I've been guilty of it for myself. There's this tendency to want a solution, and the solution might mean I have a pain, I need a CAT scan to figure out what it is so that it can be made to go away, or I need another pill. Like the over-the-counter arthritis medicines are way too heavily used, and I think sometimes folks think that they're going to get rid of the problem. They just temporarily lessen the discomfort. You can get more relief from arthritis from a gentle exercise appropriate type routine than you ever could. Well, I shouldn't say that, but often better than you could get from those medicines with no risks. Anyway, it's sort of a mindset, and you said it so beautifully, to look to yourself first, to empower yourself first. And along that same line, Mark, and it's very similar to what you said, is for folks who have sometimes complex medical histories, they have complex pain patterns with pain here, pain there. It changes. It's not clear exactly the source. I mean, I was very humbled many times, and I know my listeners know this. You will not find an exact explanation for your pain. And if you just keep seeking medicines and tests for the explanation, you miss the opportunity perhaps to change your routines, or to consider your eating habits or your exercise program or your sleeping habits or whatever, your stress level. Oftentimes that's the number one thing. The stress that people suffer from is just incredible. So I'm sure that you address stress reduction directly and indirectly in all of what you do, it sounds like.
Absolutely.
Yeah. Well, I just think this was fabulous. I'm just really thrilled. So now my listeners know why I have my good friend, Pastor Mark, to talk to us. You see how wise he is. Yes. We're going to have to go to breakfast again. It's been way too long with the COVID-19.
I look, we can have breakfast outside. We can do a physically distanced, but not socially distanced.
There you go.
Really, really fine conversation.
There you go.
Yeah.
So let me remind everybody that you can go to my website, and all of the notes and references and some of the particularly wise quotes that Pastor Mark said will be there, and you could listen again to the talk, and please spread it around to your friends and family if you think it would be helpful. So, all right. Well, thank you so much, Mark. God bless.
Thanks for having me. Bye-bye.
Bye-bye.